afternoon. Good afternoon. My name is Tammy King, and I serve as the president of the Bergen County, New Jersey chapter of the Links Incorporated. On behalf of the 53 members of the Bergen County chapter, I welcome you to today's session on breast cancer in African American women at the Black Health Matters Building the Bridge Summit, sponsored by Genentech. African American women have a 31% breast cancer mortality rate, the highest of any U.S. racial or ethnic group. We hope that today's discussion will be a step forward in helping African American women better advocate for themselves and to take the steps necessary for their breast health. Our panel is comprised of a globally respected clinician and 2 breast cancer survivors and thrivers. They are Dr. Lisa Newman is a surgical oncologist with a practice dedicated to breast cancer management. Catherine Cooper is a breast cancer survivor and is the president of Sisters Network Incorporated, Essex County affiliate chapter. Cecilia Pope, MS, BSN, RN is the president of Sisters Networks Incorporated, Greater Metropolitan Detroit chapter. Thank you in advance for sharing your stories, testimonials, and expertise. Dr. Newman.
Hi. I'm just trying to find my slides. Just a moment. Here we go. So good afternoon, everyone. Hopefully my screen is showing up. My name, again, is Lisa Newman. I'm a surgical breast oncologist at Weill Cornell Medicine. And Ms. King, I want to thank you from the bottom of my heart for what you're doing to educate our community. And thank you to Black Health Matters for making this possible. The information and the conversation that we're going to have this afternoon is critically important to women of color. And in particular, we'll be talking about Black African American women. Now, for all women, the good news is that most women with a diagnosis of breast cancer will be long-term survivors. And the message from this graphic is that over the past 30 plus years, we've had dramatic decreases in death rates from breast cancer because of the combination of being able to detect breast cancer at early stages with screening mammograms and because of advances in treatment. My message to all of you out there, please get your mammograms on an annual basis and start getting them when you reach age 40 if you are of average risk. If you have high risk because of a family history or some other issue, you might even need to start getting those mammograms at younger ages. Mammograms absolutely do save lives because detecting a cancer at a small size before you can feel it in the form of a lump in the breast increases the chances of successful treatment. Often that treatment can be with breast-saving surgery and the woman can avoid a mastectomy. If the woman is having a mastectomy, she can get better breast reconstruction. Catching a breast cancer early minimizes the chances of needing chemotherapy to treat that cancer, and it also minimizes the extent of other surgical options for that breast cancer. However, breast health self-awareness is still very, very important because breast imaging, whether you talk about mammograms, breast ultrasounds, or breast MRI, none of these imaging modalities are perfect. And so if you have a change on your breast exam, such as you notice a new lump in the breast or in the underarm area, a bloody nipple discharge, if you have skin changes in your breast, such as redness, inflammation, or swelling, or if you notice a dermatitis or eczema type of change, especially in the nipple areolar skin, these are all reasons you really need to seek medical attention promptly. Now, we don't want you to panic if you get any of those symptoms, because all of those symptoms can also have benign, non-cancerous explanations. The key is that you need to seek medical attention so that you can find out the cause of your breast symptoms. If you're not getting adequate information from your healthcare provider, please keep asking questions or seek another opinion. Other messages that are important with regard to protecting ourselves from breast cancer is that we can lower the likelihood of getting breast cancer by nursing babies for premenopausal women, For women of all ages, following a healthy, balanced diet with lots of fresh fruits and vegetables is important. Avoiding obesity, especially for postmenopausal women, is important. Exercising regularly and minimizing alcohol intake. These are all important strategies to lower the likelihood of getting a breast cancer. For all women, the breast cancer survival rates are better if the breast cancer is caught at an early stage. By early stage, I mean at a small size. However, what we see on this series of bar graphs is that at every stage of breast cancer diagnosis, the Black African American women depicted by the red bars have slightly lower survival rates compared to the women of other racial ethnic groups. Now, part of the explanation for these disparities in breast cancer outcome is definitely related to systemic racism in the healthcare system and socioeconomic disadvantages. It is tragically true that poverty rates are higher in the Black African American community. Lacking insurance is more common in the Black African American community. And there are inequities in the way that cancer care is delivered, tragically, in the African American community. All of these factors lead to the more advanced stage distribution that we see in Black women, and they also contribute to the higher death rates from breast cancer that we see in the Black African American community, as Tammy mentioned in the introduction. However, there are several other features regarding the breast cancer burden of Black African American women that cannot be easily ascribed to socioeconomics, such as the fact that we are more likely to get breast cancer at younger ages compared to white American women, and we are more likely to get biologically aggressive breast cancers, such as one that we call triple negative breast cancer. There's a higher incidence of another aggressive form of the disease called inflammatory breast cancer in Black women. And lastly, the incidence of male breast cancer is also higher in the Black African American community. So we do also need to study tumor biology and genetics when we try to understand breast cancer disparities. Now, recently, there's been a disproportionate increase in the incidence rates of breast cancer in Black African American women. So these rising incidence rates, coupled with the fact that Black African American women are more likely to get these biologically aggressive triple negative breast cancers, has resulted in a widening mortality gap. And today, death rates from breast cancer are 40% higher in Black African American women compared to white American women. So there's a lot of work that we need to do in terms of community education, research, improving treatments delivered to all women, but certainly to Black African American women. We are trying to do this work, and we're counting on all of you to continue being ambassadors to the community so that we can improve outcomes in our community. And now I'd like to turn the podium, the virtual podium, over to my wonderful survivor advocate colleague with the Sisters Network, Ms. Catherine Cooper.
Hello, everyone, and thank you, Dr. Newman, for that wonderful presentation that you just gave. My name is Catherine Cooper. I am a 21-year breast cancer survivor, and truly it is much different from what it was 21 years ago. Things have gotten better, but things need to be even much better. I had a lumpectomy when I started my journey. But as she was saying, the early detection makes a difference. Every year I was going to the doctor getting my mammogram done. And one year I decided that, hey, I don't have time to do this because I need to do what I need to do as far as home. I had a job and I was commuting every day, and I pushed it to the side. But little or nothing, my neighbor came over and she was asking for funds for the American Cancer Society. And I was like, okay, I guess I can do that. And then she said, well, did you do a mammogram this year? I said, no, I didn't have time. But you know what? That was my angel, because she had just had a double mastectomy. And because of her, I was prompted to go to the doctor within the next 2 weeks. And what happened was, I did a mammogram, and they said they saw something. And I was like, oh, no, you didn't. I do this every year. So one time was not enough for them to convince me. And so I wouldn't leave the facilities until they did it again. And you have to be proactive and convince them that they have to do what you want them to do. It's not about money. It's about making sure you're getting the proper care and getting the answers that you want. And so they redid it, and they still saw what they saw. So I was told to go to Summit to a doctor that I know nothing about. But when I went to see her, I said, listen, I need to have I need to have something done, and I'm not sure, because I wasn't active as far as breast cancer, because I just really didn't know. I just knew to go get a mammogram. And so what she did was she did a needle biopsy, and that was because my lump was so tiny that you could not even see it. But they said, well, we have to do a needle biopsy so that they could see how big it was. I guess that's what it was. I'm talking 21 years ago. And so when she did it, I came out of the surgery for the needle biopsy, and they did what they had to do. And I was in shock because I didn't want to believe that I had breast cancer. And I said, oh my God, how did this happen? It could happen to anybody. You can get a mammogram every year, and then one year it happens, and it happens to you. So I'm just saying, and I'm just repeating what Dr. Newman says, early detection makes a difference, and it starts with mammograms. It starts with self-breast exams, because even if you do your self-breast exam, it doesn't mean that you're going to feel something, and you may think that it's okay, but it's not okay. And that's why you have to do that. So my journey started when they got the biopsy back and they said it was cancer. And I was like devastated. And so I had a lumpectomy, I had chemo, I had radiation, I had a 360 change as far as what my body was going through, not just, it was mentally and physically, because, you know, I had a young daughter, a son, I had a husband, and I was like, well, how am I going to manage this? How am I going to go to work? And it was just devastating to me. And the thing about it was, I was the only daughter in my family who had breast cancer, and no one could believe that I was so healthy. So how could it happen? Does have nothing to do with health. It has what the chemistry is that's going on in your body, and how breast cancer can attack you. And truly, it did attack me. And you know what? I said, I'm going to get busy living. And if God helps me through this, then I'm going to do everything I can to help every woman, whether she's Black, white, or whatever. And I know it's about Black women that we are focusing on today and tomorrow. But you know what? Everybody needs some kind of help. And I want to be an inspiration. So I am just excited about this panel discussion. And I'm going to share one more thing with you, because I know we only have about 6 minutes. My husband, 6 years ago, was diagnosed with breast cancer. And I was devastated again, because here I am, a survivor of breast cancer. Then my husband got breast cancer. So this is like a male going through this. And I give this all to Sisters Network, because he was with us going out doing outreach, helping women in African-American communities get all the information that they needed, and to make them aware of what breast cancer is, what we need to do to make sure that they are aware. And I just thank God for that. So with that being said, I believe that it's going to get better, but we have to make it better. And it's all about giving the right information and make sure that people understand that breast cancer is going to be here. And hopefully one day it will be eradicated and we won't have to deal with it. But for now, we do. So thank you for inviting me to this panel. And now I will introduce you to Cecilia, who's another member of Sisters Network of Metro Detroit.
Thank you so very much, Catherine, and thank you to the Black Health Matters for this invitation to be on the panel with Dr. Newman and Catherine Cooper. Again, my name is Cecilia Pope, and I am a 26-year breast cancer survivor. My breast cancer story or journey actually began in April of 1995. I actually discovered the cancer myself. One morning while taking a shower, I felt something that was different in my breast. It was not a lump. There was no pain. There was no drainage. There was no swelling, no redness. The only thing that was there that was different was this area of thickness. And so I felt that I needed to bring this to my physician's attention, but I felt it could wait about a week. Prior to me having discovered this area of thickness, I had about a year ago, prior to that, I had a hysterectomy for fibroids. And because of that, it was time for just a routine follow-up with my gynecologist. So I felt I could just wait another week. You know, it should not really change the outcome too greatly. But anyways, long story short, I had the appointment with my physician. He did a very thorough breast exam and then recommended that I get a mammogram immediately. So once I had the mammogram, and unfortunately it did confirm that I had breast cancer. So I was sent to a surgeon for evaluation and for biopsy. So I had my surgery in I had the surgery in May of 1995. And then my plan of care was radiation, chemotherapy, and 5 years of tamoxifen. Now, being a nurse, I definitely know the importance of taking care of myself, getting my regular checkups, doing my monthly self-exams, and all of that was done. And I just could not understand why, you know, I would be the one that would end up with breast cancer. But that just goes to show me that breast cancer does not discriminate. Breast cancer does not care about your financial status. It does not care about your political or your professional background. It doesn't care about your gender. Breast cancer can affect anyone. But the important thing to know that breast cancer is not a death sentence. If caught early, your survivorship is much greater. What I would like to leave with you are a few things. Well, let me back up for a minute. Even though there was no history of breast cancer in my family, and I did not have the classic signs or symptoms of breast cancer, I did, after I was diagnosed, 7 years later, I had a sister that was diagnosed with breast cancer also. And so it was not until 2015 that I actually had genetic counseling and testing. And by the grace of God, everything was negative. I do not carry the genes that cause breast cancer. But what I want to leave with you, like I mentioned already, that breast cancer is not a death sentence, and it is very imperative that every woman knows what her breast feels like. Because that way, if there are any changes, you are the first one to know. You will be on top of the situation, and you need to seek the medical attention that you need and you deserve. Now, if for some reason the attention that you receive is not what you want, what you need, then by all means seek a second opinion, and if necessary, a third opinion. Also, not only is it imperative that you know what your own breast tissue feels like, but we need to know our family history. Knowledge is powerful. Knowing your family history can protect your family members, your daughters, your cousins, your aunts down the line. One of the problems with historically with African-American women is that we did not talk about what was going on with us. We have always been the ones who nurture the members of our family, the ones who care for the members of our family. But we have to realize if we do not take the time and take care of ourselves, we are not in a position to take care of anyone else. So I will end this conversation by saying, get your mammograms, be very vigilant about taking care of yourself, and remember, knowledge is power. Thank you very much.
Hello, everyone. Thank you so much, Dr. Newman, Ms. Cooper, and Mrs. Pope for your wonderful stories. I am actually we have quite a few questions in the Q&A, so I'm just going to read it off to you guys so you could answer. This is a general question, so I think it's for Dr. Newman. What are your thoughts about natural remedies?
Yeah, that's a great question. There certainly are some wonderful ways to enhance the effectiveness of breast cancer treatment with dietary supplements, sometimes with certain lifestyle practices, meditation programs, yoga therapies. All these strategies are accumulating evidence that they can improve breast cancer outcomes. They do not replace standard breast cancer treatment. And it would be great if they did. It would be wonderful if we could avoid surgery completely for breast cancer, avoid medical treatments like chemotherapy. It would be great if we could avoid those things, but that is not the situation today. Today, if you have a breast cancer diagnosed, please take standard medical treatment. It will be effective in the majority of cases in conquering that cancer. Supplement those medical treatments with other lifestyle and holistic remedies, but don't replace standard medical care with non-standard treatments.
Awesome. Also, how often do males need to get a mammogram?
Oh, great question. So we do not routinely do mammograms in men, even though male breast cancer is more common in the African-American community compared to white American men. For all men, breast cancer risk is going to be relatively low. There are some families that have certain mutations like BRCA mutations, genetic markers of higher hereditary risk for breast cancer, where the men in those families will also be at exceptionally high risk for getting breast cancer. And sometimes those men will undergo mammogram on a regular basis. But for the general population of men, we recommend that you remain aware of any new changes in your breast self-exam. So if you develop a new lump, bloody nipple discharge, change in the appearance of your breast, please seek medical attention.
That is great. Another question is, if you have a history of breast cancer in your family, how early should you get examined or get a mammogram?
So getting your professional breast exam by your clinician on a regular basis should probably happen every year when you're getting your routine checkups. For mammograms, again, average risk women, please start getting those mammograms at age 40 and continue them every year thereafter. If you have a strong family history of relatives diagnosed with breast cancer at very young ages, like 45, 40, younger than that, the rule of thumb that we use is that you should start getting your mammograms 5 to 10 years younger than the youngest age at breast cancer diagnosis in your family. If you do have a strong family history of relatives with breast cancer, ovarian cancer, talk to your physician so that you can be evaluated for genetic testing, as Ms. Pope described, because some patients with hereditary predisposition will get additional screening modalities in addition to mammograms, such as whole breast ultrasound or breast MRI on a regular basis as well.
Perfect. Before I get to a couple more questions, I see that there are 2 participants. Your hands are raised. Please, there's a Q&A box at the bottom of the screen. Please put in your questions so it could just be discussed in a timely manner, because there's not a video chat option with the participants. So just please click on the Q&A and write your questions in. Thank you so much. Another question we have is, I truly believe that cancer is linked to our food. What are your thoughts?
That is correct. Cancer is linked to food. And as everybody is aware, we do have an obesity epidemic here in the United States, and the obesity rates are higher in the African American community. If we could reduce the obesity epidemic, we would probably cut down on about 30% of the cancers, including the breast cancers that we see in this country. There is definitely a link between food and cancer. It tends to be a link with excessive food intake and excessive fatty food intake and cancer. So follow a healthy, balanced diet, and that will reduce the chances of getting breast cancer. Unfortunately, we do not know of a magic diet that can guarantee against the development of breast cancer.
Okay, perfect. What are suggestions you could give for survivors regarding emotional status after cancer? And examples may include anxiety and constantly thinking about cancer returning.
So I'll turn that question over to my colleagues, Ms. Cooper and Ms. Pope.
Well, one of the things you can do definitely is join a support group, a survivorship group where you have women that are going through the same journey or have gone through the journey that you have gone through. And, you can guide each other along the way. You can make suggestions as to how you dealt with a particular problem. And also, as far as survivorship, with these different organizations, you take your mind off of yourself and you put your mind and efforts into helping other women. And so you get really involved in a lot of different outreach activities where you take the lead in empowering women to be their own self-best advocates.
Perfect. Thank you so much. There's another question. Is the diagnostic mammogram a much different exam than a normal annual mammogram exam?
Yeah. So when we talk about mammograms, that's a very good question. You will see the physician ordering specifically screening mammogram or diagnostic mammogram. Screening mammogram is the standard mammogram that we do every year. One view taking the profile image of the breast, the other view with the breast being compressed and the camera shooting the picture from the top down. At the diagnostic images are what we frequently talk about when something is seen on that first preliminary mammogram and the radiologist wants some additional pictures. So they will do additional compression to try to basically mash the breast tissue down thinner so that they can evaluate the density or the lump that they're seeing. And then they will do magnification views of that image to see if the shadow truly is a problem that needs a biopsy. So a diagnostic view means that the radiologist sees something and they want to get a better idea if regarding whether or not that's something that requires a biopsy.
Okay, and are ultrasounds more effective in discovering the tumors than a mammogram?
Ultrasounds are a wonderful adjunct to mammograms. The radiologist will very frequently use breast ultrasound to help interpret the various shadows that show up on the mammogram. And sometimes the radiologist will recommend whole breast ultrasound, where they scan the sonogram unit over the entire breast on both sides to try to pick up tiny cancers that might be missed on the mammogram of a woman that has very dense breast tissue, which can be difficult to interpret on the mammogram.
Okay, awesome. Also, can a genetic testing for breast cancer be done through your primary care physician, or is that done privately?
It can definitely be done through your primary care physician, but whoever orders it needs to be comfortable with what we call pre-test counseling so that they can talk to you about the pros and cons of testing, understanding and interpreting the results. There's also something called genetic discrimination laws. Federal laws prevent you from losing your job or losing your medical insurance because of genetic test results. The loophole with the federal law, however, is that it does not protect against life insurance policy genetic discrimination or long-term disability policies. And so if you get your test done and you find out that you have a mutation, and then the next day you decide to take out a $50 million life insurance policy on yourself, you need to know that that insurance carrier can legally ask you about the results and use those results in deciding whether or not to sell you the policy.
Also, awesome. Thank you so much. This last question is for Ms. Cooper or Ms. Pope. How can family and friends best support someone dealing with breast cancer?
I will answer. They can best support them by being there with them. Sometimes you think that not reaching out or not, talking to them over the phone or just doing little things, because support makes a big difference, because you need somebody that you can depend on. You need somebody that you can tell them what you're going through and they can feel what you're going through. Because without support, it's like you feel like you have everything on your shoulders and sometimes you don't know what to do. But when you have someone that you can really talk to, let them know what you're feeling and how you should go about dealing with it, it makes a big difference. It's always good to have somebody that care about you and willing to go the distance with you. And that makes a good support system, because when you're going through breast cancer, it's like you don't feel like doing anything. You don't feel like cooking. Sometimes you don't even feel like eating, but sometimes you have somebody to just push you along. And that makes a big difference as far as support is concerned. So we need that. We definitely need that. Thank you.
Okay, I see that we have just a couple more pressing questions that I would like Dr. Newman just to touch on, because there's a lot of people in here with some, really great questions. Recently had shingles in my right breast. Any connection to breast cancer?
No, I would not worry about those shingles causing breast cancer, but please make sure that it is shingles. As we mentioned, sometimes skin changes in the breast can be a marker of something that needs to be evaluated.
Okay, perfect. Should women with dense breast tissue be given an ultragram?
Yeah, dense breast can be difficult to interpret on the mammogram. And when we say dense breast, we are specifically talking about mammographic measures of density, not if your physician examines you and says that you have a lot of fibrocystic changes. That's not what we talk about with dense breast. Dense breast on a mammogram means that the breast tissue looks very thick, and sometimes the radiologist will recommend additional testing such as whole breast ultrasound or even breast MRI, breast magnetic resonance imaging, to better evaluate those dense breasts.
Awesome. And can you quickly touch on the differences between chemo and radiation treatments?
Radiation treatments are very targeted X-ray beams that go at a particular organ. We routinely use breast radiation in women that have had a lumpectomy for breast cancer. And in those women, the radiation is geared towards killing the microscopic cancer cells that are often hiding in the normal appearing breast tissue surrounding the cancerous lump that was removed with the lumpectomy. Chemotherapy, on the other hand, is treatment that usually goes into the body through an intravenous line, and the chemotherapy medications circulate throughout the entire body. And chemotherapy medications are very effective at killing any microscopic breast cancer cells that are hiding in other organs of the body, such as breast cancer cells that have gotten into the bloodstream and that are hiding in organs like the liver, lungs, bones. And by giving chemotherapy to women that have early stage breast cancer, you can kill the microscopic cancer cells hiding in those organs and prevent that woman from ever dealing with metastatic breast cancer. Some women do need to receive chemotherapy because they have experienced metastatic breast cancer, where the cancer is already damaging other organs of the body.
Awesome. Thank you so much, Dr. Newman, Ms. Cooper, Ms. Pope, for your time. This was truly, truly phenomenal. I know there's tons of more questions, but we cannot go through everything at this time. However, there was great information on this panel, and we thank you, ladies, so much for your time. It was a wonderful, wonderful session. Enjoy the rest of your day, and please, you could head over to the next session on our webinar series.